The Nurse Theorists, Portraits of Excellence. In this edition, we feature Hildegard Peplau.
My parents were immigrants, so I'm first generation. First my grandfather came, then my grandmother came, and then my father came in 1899. My mother's parents never came to this country, but my mother came in 1903. They were all born in an area of Poland that was a part of the territory of Germany at that point, and they had migrated from somewhere in Germany. I think they met in Bristol, Connecticut, or Hartford. They were married in Bristol in 1907. My mother, of course, was a homemaker, and during strikes, periods of strike when my father was out of work, she would go to a shirt factory or do house cleaning for people, or she was very expert at baking, so she would bake bread and make donuts and sell those. My father was a fireman on the Reading Railroad, which was about a block away from our house, and he was very proud of that. I think that was a major achievement for an immigrant boy who really had no real education. I had 5 brothers and sisters. I'm the second born. In those days, choice number 1, of course, was to get married, and then choice number 2, 3, and 4 would be like to go into a convent if you were Catholic, to become a teacher if you could afford to go to normal school, or to become a nurse where they paid you. And when I was a student nurse, we got paid $5 a month for the first year, $10 a month the second year, and the third year we were supposed to get the magnificent sum of $20 a month. However, it was the Depression, so we didn't get anything. I went to Pottstown Hospital Training School. I went in 1928 and graduated in 1931. I really enjoyed training. There was always something new and fascinating. Medical science wasn't very far along at that point. There were no interns or residents at our hospital, and so the physicians tended to pick out bright nurses and lend us books, let us assist in surgery. I took out tonsils, I delivered babies. I did all sorts of things that student nurses now wouldn't get much of a chance to do. Then I studied at Bennington and got my baccalaureate in interpersonal psychology in 1943. Then the war came and I felt that I ought to serve my country. So then I joined the Army, and in August 1943 I went into the Army Nurse Corps. Second-borns are more people watchers than first-borns, for one thing, and we had a lot of very strange people in the general environment because in those days psychiatric casualties of one kind or another were not hospitalized. So when I was a child, they were on the streets. Not a lot of them, but there were some, and I wondered about them. I wrote the book in 1949 at Teachers College. And the first publisher, as you may probably have read somewhere, turned it down because no nurse should write a book of this kind. And if I would have a physician co-author it, he didn't have to do anything, just put his name on it. They'd be glad to publish it. And I said, no, we won't do it that way. So then I wasn't going to publish it. And then we had G.P. Putnam's sons had an interest in it. And then they established a nursing committee. And the nurses on that committee hemmed and hawed, and they said, take this out and put this in and change it here. And I said, no, we're not going to do that. So finally Putnam employed Genevieve Bixler, a non-nurse consultant, and she finally said, publish it. So the book came out in '52. Actually, it was ready to go in 1949.
I met Dr. Peplau in 1972, and I had just entered graduate school in psych nursing at Rutgers. I think that we are talking about a person who has devoted many, many years to helping mental patients to get a better shake, if you will. And that in Dr. Peplau, or Hilda's studies of mental patients, that in communicating that to so many students across the years, that I think the mental patients have fared a great deal because of that. And I think there are changes in the mental health system that would not have happened if it were not for the work that Hilda did indirectly through students.
I met her personally when I had applied to graduate school and came to Rutgers for an interview. A good deal of her work has not been credited because it's almost become the public domain in nursing. Some of that is because the work has not been published. Some of it has also been a problem because she's been incredibly generous in sharing various dimensions of her thoughts on human behavior and clinical problems with people who, for example, just write her a letter.
Miss Peplau discussed her definition of nursing with Dr. Jacqueline Fawcett near her home at the Westwood Marquis in Los Angeles.
Hildegard, I'd like to thank you so much for agreeing to this interview. It's just wonderful to get to meet you and to have this conversation.
Well, it's my pleasure to meet you. It's nice to be here, too.
Your book, Interpersonal Relations in Nursing, was published in 1952, one of the first of the books about nursing theory that have appeared. I wonder if you could tell me what motivated you to write your book.
Well, I thought I had something to say that the profession needed to know. Actually, the book was ready, the manuscript was ready in 1949, and it was, there was an article in the American Journal of Nursing in 1951 that predated the publication of the book. But in studying interpersonal psychology, as I did at Bennington College, it occurred to me then and later that this was an important theory, that it had great relevance for clinical practice, and that the profession needed to know about it, and so I published a book.
So then interpersonal psychology was very influential in your thinking in leading you to your ideas that you presented in your book?
Well, yes, but it wasn't only interpersonal theory, it was other theories as well that I had studied. I studied in the social sciences generally at Bennington and did a great deal of reading also, so that it wasn't just interpersonal theory.
People have said that your work has been very influenced by Harry Stack Sullivan. I wonder if that's the way you see it. Do you see his influence on your thinking?
Well, actually the term interpersonal relations was coined by Jacob Marino of psychodrama fame. But Sullivan, of course, used the term and developed a theory of interpersonal relations in terms of psychiatric work. And he is perhaps the major American psychiatrist. He has not yet been fully recognized as such, although I think that recognition is coming. It's coming rather slowly. But he developed his theory from clinical work with patients and from the social science of that day that was available. He knew, for instance, Sapir and George Herbert Mead and other social scientists who were around at that time. And he put all of these together in terms of a theory that was useful clinically.
And then you drew upon his work as well as the work from other people to develop your theory.
Well, I also knew Sullivan. I heard him lecture, and I worked at Chestnut Lodge in the 1930s, so I was exposed to his work and his lectures, and I could see some of the effects of the application of such theories to clinical work. And then, of course, I studied it at greater length at Bennington, and of course at the William Allenson White Institute. I have a certificate from that institute.
Have you wanted to make changes in any of the work that you have in the book since that time?
No, not really. I have written other things. I don't think that when you talk about my work, I don't think it should be limited to a book I published in 1952. I did other things. So let me take a minute or two and say what the work was. First of all, I took personality theory, which goes beyond interpersonal theory and includes a lot of theories that were developed by psychologists and sociologists and child development persons. And I showed that this is the theory, and if you apply it in nursing, this is what it will help you to understand about patients, and this is what it will suggest that you should do or might do that would be beneficial. I also took Mauer's work on conflict and the work of Miller, Maurer, and Sears et al. On the frustration-aggression hypothesis. So I took these two constructs and again showed the explanatory power that it had for clinical work and the directional power that it had in terms of how one might help an individual resolve a conflict. I also used the literature and quite extensive empirical clinical research data to develop the concept of anxiety, and I think quite an original way, long before the mental health professionals were talking about anxiety as an interpersonal phenomenon. And I developed a construct of that in terms of levels of anxiety, in terms of indicators that nurses could use to observe the presence of anxiety. And from that, I suggested modes of intervention that nurses could use. I also developed the process of hallucinations as an interpersonal process, showing how this is a perfectly natural kind of phenomena using inborn capacities that everyone has and the circumstances under which those capacities are used in the direction of the psychopathological symptom that we call hallucinations, and then also what you can do about it. I have just done a rather extensive paper on that for a book that's to come out in Scotland next year. I also have developed the self-system using basically Sullivan's work, but also from Reichman and others, beginning with the work of Cooley and George Herbert Mead and others, and put that together in a construct, and then showed how nurses can, using that construct, help patients to bring about changes in the contents of their self-system, which is a very important thing that nurses must do with patients who have amputations, patients who have been in severe trauma. The psychiatric patients, of course, come with a very low self-concept, loaded with derogatory content that has to be unloaded in some way, and I have shown nurses in the literature how to do that. So I don't want my work confined just to a 1952 book. I have written as late as last week and published other kinds of things and gone well beyond the book.
Well, that's very informative. I think
I
it
don't
really
want
helped.
to deny the book either. It's a classic. It's a book that is going to be reissued shortly by Macmillan in London.
That's wonderful, just wonderful. When you were talking about all of this work, you began to mention areas of traditionally clinically nursing that might be like medical surgical nursing and other areas that are more traditionally known as psychiatric mental health nursing. And I was wondering, when you state in your book that the functions of psychodynamic nursing are being able to understand one's own behavior, to help others to identify felt difficulties, and to apply principles of human relations to the problems that arise at all levels of experience. then what preparation is required for psychodynamic nursing? How does one develop skills in these functions?
Well, I think there are two things. I think the nursing curriculum ought to be built on a liberal arts education, and that would bring the social sciences and the humanities as a background. And then nursing theory, as it develops, I think has to focus more closely on the kinds of nursing phenomena that nurses are expected to diagnose and treat, which it has not yet done to any great extent. And then I think when those two get together, you will have what I think is necessary for, I wouldn't call it psychodynamic nursing, I would call it a humanistic approach in nursing at this point.
Part of what I was trying to ask there was, would every nurse be able to use your work, your theories, in the care of his or her patients? Or is this work best used and most capably used by nurses who have special preparation in what we call psychiatric mental health nursing?
No, every nurse, I think, needs to deal with the human type problems, or as the ANA definition of nursing says, the human responses that patients or people have to actual and potential health problems are within the broad scope of nursing. They're not confined to psychiatric nursing. One of the things that I have done and put in the literature is a method of psychotherapeutic interviewing. Well, I have done that in two ways. One, in terms of how one deals with psychiatric patients who have very critical psychiatric problems, and then how one uses the same framework in a counseling way with all patients. But no, I think every nurse has to be able to deal with the human difficulties or human dilemmas that people present to them and that interfere with their health.
What influence do you think that your work has had on nursing education? How has your work influenced what we teach to our students?
Well, it's hard to say. Nurse colleagues tell me that my work has more or less been absorbed into the nursing culture, and the evidence for that is that some of it is printed verbatim without attribution, and there's quite a bit of that goes on, which suggests that they don't remember the source any longer.
So you're truly in the public domain.
I think it's been in the public domain, and after 25 years, even the book is in the totally in the public domain until it gets reissued.
Have researchers in nursing been able to validate your idea of the nurse-patient relationship and the phases of orientation, identification, exploitation, and resolution?
Well, there have been a number of studies. I don't actually keep track of the research that's being done on my work. Perhaps I should, but I don't. There is a nurse in Canada named Fawcett who is doing some research on it now. I think she has an upcoming publication in the Journal of Psychosocial Nursing on that. There have been other researches, particularly on hallucinations. There have been at least two that I know of, Cynthia Rector's work and Bill Fields at the University of Texas in Austin. And they have pretty much validated, not the total construct, but most of it.
I found that your idea of the various roles that nurses could play as particularly intriguing. I wonder if you would comment a little bit on that.
Well, when I put that in the literature, and that was quite early, that was in the mid-50s, I believe, may have even been earlier. At that point, nursing, as you probably know, started out with activities. We had an activity study, and they counted up all the activities that nurses do. When I was a student nurse, we had to write down every 2 minutes what activity we had just performed, and then somebody at the league toted all those up Blanche Pfefferkorn, as I recall.
I never knew how those studies were done. That's
Well,
incredible.
I was one of the subjects that collected data. Then they moved from activities to, well, first before activities there were duties. And all the books before 1930 were full of duties of nurses, what nurses should do, ought to, must do, don't do, and so on. This is your duty. And then the activities. Then we moved to functions, and there were many function studies. Then we got to roles, and by the time they were into roles, I came up with a paper on roles. So I'm as much a product of my time as anyone. Then we moved on to other things, and I did too. But at the same time I was coming up with the idea of roles or sub-roles in the nursing role, I was also working on clinical phenomena that nurses had to somehow provide nursing services that would have favorable outcomes for patients.
Clinical phenomena such as anxiety or
Such
hallucinations?
as anxiety, hallucinations, self-system, language thought disorder. I have quite a lot in the literature on that, and so on.
How would your work help the administrator of nursing services? You say in your book that, and in your other writing, that an interpersonal relationship is an interpersonal relationship, regardless of whether it's between the nurse and the patient, a teacher and a student. And I wondered if you would see that the phases of that relationship would be germane to administrators in their dealing with their staff.
Well, I can think of a few administrators in my checkered past who might benefit or might have benefited by some knowledge of interpersonal relations. But interpersonal relations occurs at all levels. And one of the main points about it is that you use participant observation rather than spectator observation, which is what we used in the 1930s. You kind of put the patient in the corner and you looked at him and you said, this is what that object is doing. With participant observation, you have to look at what you're doing that calls forth or evokes whatever responses are occurring, and you try to puzzle out what the relation is in the relationship. And many administrators would benefit by taking a look at the behavior that they use with faculties in academia, with nursing staff in hospital settings and elsewhere, that calls out certain kinds of responses. What is it that nursing administrators do that contributes, for instance, to staff turnover? I think it would be a very important study. Or what is it that's not only deans but faculty members do that increases attrition of students from schools of nursing?
Or decreases it.
Or decreases it, right.
You've mentioned earlier in our conversation that you've been writing papers recently. I wonder if you could tell us a little bit more about what you have been doing recently.
I try to do as little as possible, but it doesn't seem that I can manage that. I seem to be busy. I have just completed a chapter of a book on updating the concept of anxiety, the self-system, and hallucinations for a book in Scotland. And I like it. I like the work. And I'm on my way to Montreal to give a paper, so I've just written that.
And what is that on?
It's on the substance of psychiatric nursing, substance and scope of psychiatric nursing.
What are your plans for the future beyond going to Montreal?
Well, I more or less play it by ear. I have no commitments after I get back from Montreal, and that's the way I want it. I've been working on a genealogy for about 5 years, and I want to pick that up. I have a lot of new materials that have come in since Christmas when I finalized the copy that I have now, and I want to deal with those materials, and then I have some new leads that I want to pursue. And that's a pretty time-consuming business.
This is of your own family?
This is of my family.
How fascinating. Now, your own work is in the archives at Radcliffe?
Yes, my papers went to Radcliffe when I moved to California. It was a sensible thing to do. It would have cost twice as much to ship them. And there are 46 cartons, so there's quite a lot. But it's not only my papers. It would be a mistake to think of it that way. It really is the history of psychiatric nursing, at least from 1948 to when I retired in 1974. My books, my old textbooks from when I was a student nurse, I didn't keep. I sent those to the History of Nursing Museum in Philadelphia, which is making a book getting a book collection together. And I had some of the old textbooks, Van Blarcom and so on.
What do you think has given you the most satisfaction in your career as a nurse?
Using my head. I mean, I like to become involved in puzzles or issues or questions and then pursue them as best I can. And with the resources that have been available to me, I think the nurses today are much more fortunate. There are more resources and more acceptability of scholarship, more the climate is more favorable for scholarship and research now than it was in an earlier era.
Well, I'd like to thank you again so much. This has really been an absolutely fascinating experience for me. I've learned so much, and I'm sure our viewers will also, about you and about psychiatric nursing and the fabulous contributions you've made. Thank you very much.
And thank you for those kind words. It's been nice for me to be here, too. That's my niece's child, David Eric Gordon. He's 6 years old, and he goes to Curtis School here in Los Angeles. He speaks of himself as being a scientist. Well, we plant garden. Of course, the construction is going on here now, so that I don't have a garden this year, but we do have tomato bushes in pots out there. We have carrots in pots.
We started with seeds and put them in these little containers that you saw in that one kit. And then you just slide them in, the seeds, and then it just comes out like those.
When the construction is all finished, we'll have a garden again, and we plant corn and peas and beans and flowers. He likes to do that. He likes to dig, and he likes to climb. He's got a very good mind, and he's a very interesting child, and I'm very glad to have a chance to have a hand in his growing up, which is one reason why I'm in California.